Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss the impact suicide has had on the epilepsy community, what contributes to someone feeling suicidal, steps in helping someone who is considering suicide, and resources. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. Suicide is death caused by oneself. Many struggle with severe depression and suicide tendencies on a global level. Many avoid seeking help due to the stigma that is placed on depression. A study from 2003 to 2011 found that individuals with epilepsy, 16.89 per 100,000 people, are 22 times more likely than the average population, 13.84 per 100,000 people, to commit suicide. Research has supported that epilepsy, psychiatric disorders, and suicide are pathophysiologically linked. Mental health screenings are important for individuals with epilepsy to prevent suicide, especially for individuals who are 40 to 49 years old. Suicide is a public health concern, and despite it being a difficult subject to talk about, we must advocate for better mental health services to help prevent people from committing suicide. Suicide is considered one of the most significant issues plaguing the epileptic community. Economic instability, poverty, debt, health complications, lack of support, and job insecurity can all lead to severe depression and can cause someone to experience suicide tendencies. Research has shown that depression impacts around 30 to 50% of people who are battling epilepsy. It is important to help those battling severe depression and suicide tendencies find the services and resources they need. In order to help someone who is having suicide tendencies or has attempted suicide, it is important to do the following. You must come from a non-judgmental stance, express support, empathy, and kindness. Individuals with epilepsy are most likely to poison themselves, most commonly with their anti-epileptic medication, than someone who does not have epilepsy. Family, friends, and caregivers are important to people who are dealing with epilepsy and are experiencing suicidal thoughts. Supervision is crucial at home due to most suicides occurring at home and the person expressing previous intent. Steps to help someone considering suicide. Assess for safety, lessen the potential harm, and decide whether health and safety professionals need to be called. If necessary, do not leave them alone until help arrives. Ask the patient if they are contemplating suicide. Asking the person if they are thinking about suicide does not make them more willing to end their life. Ask the person if they have someone they can speak to about these feelings. Assess for potential support systems. Direct them to a licensed professional to manage this crisis or seek aid from a crisis hotline. Helping someone contemplating suicide can be very impactful. It may be helpful to get help or speak to someone else. When helping somebody who is considering committing suicide, it is important to make sure you say helpful phrases and not unhelpful. Helpful phrases: how can I help you? Unhelpful: you are overreacting. Helpful: I am here for you. You are not alone. Unhelpful: it is all in your head. Helpful: are you thinking about suicide? Unhelpful: what do you have to be sad about? Helpful: has this happened before? If so, how did you manage it? Unhelpful: get over it. Helpful: do you have someone we can call? Unhelpful, downplaying the significance. Helpful, what are things that can help you feel better? Unhelpful, belittling their experience. Listed below are helpful resources that may help you or someone in need. National Suicide Prevention Lifeline, Online Lifeline Crisis Chat, the Veterans Crisis Line, SAM HSA Treatment Referral Hotline for Substance Abuse, RAIN National Sexual Assault Hotline, the Trevor Project, Suicide Safe, the U.S. Substance Abuse and Mental Health Service Administration's Suicide Prevention Act, Mental Health First Aid, meet with your primary care provider, local walk-in clinic, emergency department, or urgent care. Stay involved in local, statewide, and federal policy that may affect these resources. To see more about suicide prevention, check out the American Foundation for Suicide Prevention website at www.afsp.org/suicide prevention resources. In conclusion, suicide is death by oneself. Around 30 to 50% of people who are battling epilepsy struggle with depression. Individuals with epilepsy are 22 times more likely to commit suicide compared to the general population. Individuals with epilepsy are more likely to poison themselves with their anticonvulsants to commit suicide compared to people who do not have epilepsy. Economic instability, poverty, debt, health complications, lack of support, and job insecurity all can lead to severe depression and cause someone to experience suicide tendencies. To help someone who is experiencing suicide tendencies, you must come from a non-judgmental stance, express support, empathy, and kindness. Take the proper steps in helping someone experiencing suicide tendencies. Ask the right questions and help them find the resources needed to get help. To learn more about suicidal ideation in patients with epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.